Good afternoon. Am I on? Yeah. Everybody hear me okay? Yeah. Thank you very much. Who here knows of somebody that has chronic illness that doctors can't find the cause for, can't find the treatment for? Anybody here tired of being told their symptoms are psychosomatic or caused by anxiety or depression? Or their divorce? How about this one? Is there a common cause for infections of the heart? And if so, what is it? Who knows that it's gum disease? So welcome to the Integrative Health Services, the medicine of the future. My talk is going to be the root cause of your illness. Is it lurking in your mouth? By attending this expo and this lecture, you are becoming part of a groundswell movement in the whole world of people that are joining together and saying, I am going to take the responsibility for my health into my own hands. They are not letting the government or the insurance companies or even their MD to dictate to them what they're going to do for their own health. Some of it is disappointment in the allopathic model. Some of it is the fact that you're not getting better even though they are doing what they are being told to do. They are saying, I want to be an educated consumer of health services, not a victim of the system. In this short presentation, you will learn that there may be hidden causes of declining health in your teeth, your jaws, your gums, in the form of infections and toxins that you may not be aware of. My background is dentistry for 42 years. 30 years of that was holistic. Holistic in the sense that I was mercury-free, and I tried to find the safest materials, safest procedures. After retiring, many of my patients said, you were the guide for our health, so please don't leave us. And that's when I went into wellness. I now help dentists to prepare their patients for amalgam removal. That means that I guide them through the process of having their amalgams removed safely so that they don't get retoxified or more toxified by having the procedure done properly by the right people and having the support of the detox before, during, and after. Helping medical doctors and naturopaths and other health providers to uncover the dental component that may be missing in their full diagnostic capability. I'll be glad to answer questions at the end of the session or at our booth, so please make a note of your questions so that you don't forget them. We already know about mercury in dental fillings. Most of the people here are the choir. Mercury is released from these so-called silver fillings constantly until they're taken out. And we know that heavy metal toxicity is deposited in our bodies, in various organs, in bones, in our brain. But mercury is not the only issue. Did you know that braces contain nickel? Nickel causes depression. And especially at a time when the hormonal changes of puberty are rampant. Palladium is a common metal used in crowns these days, partly because it's very strong, it's very light, and it's cheaper than gold. Palladium is extremely neurotoxic. And right now, I don't know of a detox method to get rid of palladium. There's cobalt in partial dentures. There's toxic monomer in dentures. There's titanium in your implants, and even though it's under the gum, it blocks the energy in the meridian of that acupuncture meridian. And then you might have an implant, a crown, and a partial denture or braces. You end up with dissimilar metals. What happens with dissimilar metals? Who knows here? Tell us. What happens when you have dissimilar metals? Our grade 10 or 11 physics. You put two dissimilar metals together, you end up with a battery. Okay? And I'd like somebody to come up for a little demo that has a battery watch. Do I have a volunteer? Do you have a battery watch? Come on up. You take your watch off, please. Thank you. Which is your strong arm? Okay, put it out in front of you, like that. Okay, and do not let me take it down, okay? I'll do it from here. Resist me to see. She's not too strong. Put this, just hold it in front, no, with the other hand. Okay, now let's see. Okay, this is what happens to every single one of you. And yet we have batteries around us and batteries in our mouth. Thank you. So that is the electromagnetic, the EMF. If you have a radio beside you in your bedroom, at least turn the LED display away from you. Or get all the electronics out of your bedroom. So that's just one thing, the battery in your mouth. But what about infections? You say, well, the only infection I have is a little bit of gingivitis. A little bit of gingivitis may or may not be a bad infection. We can put it under a microscope and see whether it's caused by bacteria, by fungus, or by parasite. If it's caused by bacteria, fungus, or parasite, every time you eat or brush, what happens to those? It's digested. They go straight into your bloodstream, just like a little bit of nitroglycerin under your tongue, right? So when you brush, you can put it straight into the bloodstream, especially if you have bleeding pockets. And what happens when you go to the hygienist and she or he scales your teeth? That sharp instrument is putting the pathogens straight into the bloodstream immediately. This is why, for the last 20 or so years of my practice, when I was aware of this, I would not allow a scaling of my client or patient until we got rid of the infection first. Doesn't that make sense? MDs will not take infected tonsils out because they don't want to spread the infection into the blood. But dentists take the pockets and just infect the blood every time they scale. So I try to teach dentists and hygienists how to do it the right way. And I'm having a course next week if anybody knows the hygienist that would like to take that course. So gum disease affects 87% of North Americans. It's one of the most widely spread infections there are. 67% of the patients walking through my dental office not only had an infected gum, but that infection was parasites. We don't think of parasites as being something that we deal with in our modern clean society. Well, we do. And Entamoeba gingivalis is the most common one. It's very easily spread, just like a cold, and it is the most destructive gum disease you can have. These are parasites that I can see under a microscope. None of these people, or many of these people, didn't have the symptoms of gum disease, whether it was gingivitis or bleeding or swelling. So I could tell them, you have a pathogen that may cause you problems. If you get rid of this pathogen, you will prevent gum disease. The circulating bugs, when they go into your bloodstream, they don't just circulate and then somehow get into the lymphatics and somehow get eliminated. They settle out on organs as they pass by. The rougher the organ, because of plaque buildup or injury or whatever, the more vortex there is around that organ, the more readily these will settle out. So if you happen to have a heart valve that isn't closing properly, you have a vortex, the bacteria, the viruses, the parasites will settle in there, and when that infects, what is it? It's called endocarditis. But gum disease is not the only culprit. An abscess tooth, an infected root canal, or a cavitation, which is a hidden infection in the jawbone, especially after an incomplete extraction. And can anybody tell me what an incomplete extraction would be? It is one where the ligament, the periodontal ligament that holds the tooth in the socket is not removed. So it's like leaving the afterbirth after a child has been born. Leaving the afterbirth in the mouth. Or it could be an extraction that left a piece of tooth in or some broken bone in, and you end up with something called dry socket, where the infection has melted the whole plug of blood, and you have dry bone. That infects very badly. Is one of the most painful things. Or you could have trauma hitting your jaw and causing an osteomyelitis that is encapsulated and stays there and you never know about it. Or anything that slows circulation down. So let's say you're a smoker and drink coffee. That will make your blood vessels smaller, and that will slow your blood circulation down. And you can have a mini stroke into your bone. Instead of into your brain, it goes into your bone. And that can kill the bone in your jaw. You don't know about it, but all of a sudden some weird symptoms start, whether it's tinnitus in your ear, or whether it's fibromyalgia, or whether it's something like cancer or whatever, and you can't find a reason for it. Sometimes it's these hidden infections in the bone. Even stress can cause you to clench and drive the blood from around the bone out. These cavitations are often overlooked, and an example, John came into my office after researching his problems for many years. He had been losing the strength in his upper body quite quickly, and to the point where when he came into my office, he could not dress himself, feed himself, drive, or work. Tall man. Anyways, he had researched this cavitation issue and thought maybe it was a cavitation. We did find cavitations. We were able to treat him non-surgically. Within 3 months, he was back to work. Yet, he had been written off, told actually by the doctor to go home and die because he's psychosomatically crazy. So, it's just something that nobody knew about, but we could uncover with the technology of a sonar cavitat machine. Another issue is root canals. 75% of all root canals are found to be infected. If you think of a thumb that is infected, and instead of treating the infection, you embalm it, and you walk around like that. That's a root canal. You have a dead tooth that has toxic elements and infected elements in it. So yes, there are some root canals that get away with it because the technique was right, the situation for which the root canal was right, and there was no, it was an extremely clean process, properly filled. But most of the time, in 75% of cases, we do find infection. There are ways of maintaining those teeth if they are extremely critical to our lives, and we can talk about that in a question period. But root canals, as a general rule, are a big issue. In 30 years that I have been aware of it, I didn't see one case of breast cancer that didn't have a root canal, an infected tooth, or a toxic tooth, on that meridian, on that side. And that is a strong statement to say. Okay? So, I'll give you a story. One of our friends, he's a pilot for Air Canada. He came and said, Oksana, I want a second opinion. Sure. I said, you have an infected wisdom tooth. I suggest you extract it. And make sure you extract it right, because you're a pilot. That's on your heart meridian. Well, he left. I didn't do extraction of wisdom teeth by that time, so I suggested he go to a good surgeon. 2 weeks later, he said, oh, you know what? I went back to my dentist, and he convinced me to save that tooth with a root canal. And I said, you're a pilot. Your heart is very important. It's up to you. Your choice. A year later, he called me. I said, where are you? You sound terrible. He said, I'm in the hospital. And you were right. I said, what was I right about? Because by this time I'd forgotten. I'm in the hospital with severe endocarditis. And they need to do heart surgery for me. He was off work for 2 years. He's just getting back to flying. And he has aged 20 years. So, just a mistake like that, instead of getting a second opinion and following that opinion, he got convinced by his dentist that it was all malarkey, because what do these natural people know? So, you don't need to accept the diagnosis of depression, of anxiety, of incurable or psychosomatic illness until you have turned every stone, looked under every leaf, and investigated these factors which are out of the realm of the physician and the naturopath, but they are in the realm of dentistry, which dentists do not recognize. So, with the microscopic slide, which we are demonstrating in the booth right now, or with the cavitat available through our offices, you can turn that stone or that leaf and maybe find the issue. Thank you. The next people to speak are my colleagues at the Jaconello Center. Dr. Jaconello is well known to most of you. He graduated from London Hospital Medical School in London in 1967. He looked a little younger than that, but anyways, and he's one of the pioneers who does functional orthomolecular and natural medicine in addition to the medical practice that he has. I have taken many, many courses with him, and he is dedicated to the pursuit of knowledge. And Dr. Adrian works as a naturopath and will use
Dr. Nasager works with the clinic because we're trying to achieve an integrated clinic where we use more than one modality of treatment. Dr. Nasager and I work together in integrating and helping the patients who come to see us. Are we ready to start?
We are ready to start. So I'm just going to walk through the PowerPoint. So basically, we're going to be talking about integrative medicine, which is what we're doing at the Jaconello Health Center. A lot of people talk about integrative medicine, but it's not necessarily clear what that means or how they're going about doing it. So we're going to try and explain to you how we're doing it. So first, we're going to talk about some definitions of integration and what integrative medicine means to us. Then we'll show you the clinical process that we go through. And then we'll talk about some cases so you can see sort of real examples. So first, just thinking about the word integration, if you take it back to its root, it comes from the word integer, which means whole. So I think a lot of people don't think about that. They think about putting things together, but it actually means whole. We think about the word integral. This is something that's essential to completeness. And then going to the words like integrate means to bring together things and incorporate them. Or integration, this is probably my favorite definition here, is to combine or coordinate separate elements so as to provide a harmonious and interrelated whole. So it's not just about bringing these disparate elements together, it's about harmonizing and balancing and synchronizing these components of a person's health together. And then we also look at what does it mean then to be integrated when you are actually to that realization of integration. And it's organized or structured so that constituent units function cooperatively. And it's this idea of functioning, and we talk a lot about functional medicine, which is a sort of a subset of integrated medicine. But it's this cooperation between the parts and not just sort of smushing them together. And then I also think integrative medicine also includes the word integrity, which means a sort of a sense of congruence with the congruence in the way we practice, but also congruence with oneself, that these components are, again, harmonious and reflecting of a person's actualized self. You're talking about
Okay. So, integrative medicine, you know, this is an interesting subject. Merriam-Webster defines it as medicine that integrates the therapies of alternative medicine with those practiced by mainstream medical practitioners. The defining principles of integrative medicine include the patient and practitioner partners. You know, when a patient comes to our clinic, that communication is very important. And the patient often gives the practitioner the answer, if you ask. And this communication we try to empower the patient to take responsibility and improve their health care. We just give them some tools to help them able to do that. All factors that influence health, wellness, and disease are taken into consideration, including mind, spirit, and community, as well as the body. And the appropriate use of conventional or alternative methods facilitates the body's own innate healing response. It's initiating the healing response that's important. Effective interventions that are natural and less invasive should be used wherever possible, and that's what we try to do at our clinic. And good medicine is based on good science. It is inquiry-driven and open to new paradigms. And along the concept of treatment, the broader concepts of health promotion and prevention of illness are paramount. So presently, this is what we do. Practitioners of integrative medicine should exemplify commitment to self-exploration and self-development. So we have a clinic, so it's the intelligent combination of alternative and conventional medicine, and restores a focus of medicine on health and healing and away from symptoms, disease, and management. And you could call it whole person medicine. So today we're going to give you some case histories. Our clinic we work with a number of people at the clinic. We have Dr. Nasager, myself. So we have a naturopath, a medical doctor. We also have a nutritionist who works with whole foods. gluten-free diets, very, very expert in helping patients to eat the correct food. We have also, we have acupuncturists there, and also Dr. Helen, and we have Dr. Passis, who's a homeopath who does environmental medicine and allergy testing and works with vapor machines. So we try to integrate the whole issue. And of course, our lecturer this morning, who deals with the mouth and problems with health in the mouth, which is very chronic oral disease, is a real cause of chronic disease in some patients. So we try to integrate those things as best we can, and we're going to illustrate it with a case history. Do you want to start with it?
Sure. So this slide here just demonstrates some of the ways that we're working to integrate things. So Dr. Jaconello talked about a lot of this already, but essentially there's three components. There's an integrative assessment, which basically we're using multiple practitioners to get various points of perspective. Using comprehensive history, questionnaires, physical exam from a functional medicine perspective, also what Eastern diagnostics like pulse and tongue diagnosis from Chinese medicine. We do conventional lab tests, but then we also do some functional or advanced lab testing that isn't available through normal labs. And then we also often do therapeutic trials of a treatment that we think it might work. And then this is a list of some of the practitioners that we work with. And then also integrating with the communities. You'll see in some of the case examples of how professional referrals, working with friends and family, integrating with community support organizations in public health. We have an environmental counselor that talks a lot about environmental resources, and then food supply with our nutritionists. So it's all about sort of integrating the assessment, integrating with other treatment modalities, and integrating with the larger community. So this is a model that we use. It's called the Functional Medicine Matrix. And if we're talking about integrating, we need to know what are the pieces that we're trying to integrate. And so this is one model that's been proposed by the Institute of Functional Medicine. And you can see it's a bit complex, but the idea is that there are these essential themes. So on the one side we have patient stories. So these are called antecedents, triggers, and mediators. So these are the origins of disease. So we have antecedents. So these include things like genetics and pre-birth or sort of early life influences. We have triggering events, so these are often things that patients can identify as it all started when this happened. And then we have things called mediators or perpetuators, and these are things that continue to perpetuate the issues. So often these are lifestyle factors or inflammatory factors that sort of continue to stop the body from healing. We call these obstacles to heal. On the bottom we have fundamental lifestyle factors, so these are things that are essential to health no matter who you are. I think most people would agree that these are essential. So sleep and relaxation, exercise and movement, nutrition and hydration, stress and relationships. So those are essential no matter what your state of health. And then in the middle we have what are called the core clinical imbalances, and so these are the things that generally go wrong. And so this is a different approach to pathophysiology than the conventional Western approach where you have these discrete entities of disease. These are sort of themes of things that can arise, and it's very similar to Chinese medicine in that we have these core clinical imbalances that result in various different illnesses. So for example, you see defense and repair, which includes inflammation, and that could be a list of inflammatory conditions from heart disease to arthritis to gingivitis. They're all related to the same core clinical imbalance of inflammation. So essentially, we're assessing people on these parameters to try and find out where do you fit? What are the areas that are working well? What are the areas that need support and need to be balanced? This is the clinical process that we go through. So when a patient comes in, Dr. Jaconello will do the initial intake with the questionnaires and an interview, and that usually takes about an hour and a half. It includes a physical exam, a review of medications and supplements. Then the next visit, they'll see me, and I'll review their conventional blood work. And so at every step, we're getting new perspectives. We're adding to the clinical picture, and we're modifying the treatment plan. We're refining it so it becomes more precise. So I'll review their conventional labs and make modifications to the treatment plan. Then they'll see the holistic nutritionist that can give them practical advice as to how to implement a lot of the dietary strategies we suggested. Then next we'll come back to Dr. Jaconello for the program. At this point he'll have the conventional labs and he'll also have the functional labs. So we do oxidative stress testing, hair mineral analysis testing, so you can integrate that new information, plus see the response that the patient's had up to that point. and then again make modifications, and then I'll follow up with the patient after that. And then if at any point we need to make referrals to some of the other health practitioners, we can do that. And you'll see that in the cases that we present. So you want to go ahead?
Okay. So let's exemplify what we do by giving some case history. So we're going to present a case quickly. This is a lady, she's age 69. She came in with symptoms of fatigue, muscle weakness, poor endurance. You know, she could do a housework and then have to go to bed for a couple of hours. And she had real digestive issues. She couldn't digest fats very well. She'd had a cholecystectomy many years ago. She'd also had a complete hysterectomy in 1986, I think she had that. But so she comes in, she's not feeling well, I'm tired, I can't move around, it sort of upsets me. So I did a physical, and not much on physical, but the testing that we did showed the BIA. We do what's called a bioimpedance test, and it measures body mass index. We found that her fat mass was high and her muscle mass was low, even though her weight was in the upper range of normal. You find this in a lot of people. She's losing a lot of muscle mass. And this is called sarcopenia. Penia means less and sarco means muscle. Sarcopenic obesity. And so when you don't have enough muscle mass, you don't have less strength, because you need muscle for strength. We also checked her intracellular water levels, which were low. We do this on the bioimpedance testing. It's a very simple test. It gives us an awful lot of information. So this indicated that she had issues with leaky cell membranes and reduced cell membrane integrity. Of interest, when she came in, she was already taking medications. She was on desiccated thyroid, she was on bioidentical hormones, so she was being restored in that way when she came in, but still was not feeling well. So on further assessment, we did an oxidative stress, and we found increased levels of a thing called malinaldehyde. This indicates damage to the cell membrane, and that indicates oxidative stress. And we measure levels of antioxidants, and she was low in gamma tocopherol and lycopene. Her blood test did show she had high cholesterol levels. So, and her stool testing showed no growth of candida. So we have issues with cellular dysfunction, increased oxidative stress, reduced muscle strength. So what we did was to treat her, again, nutrition was important. She went to the nutritionist. We put her on a candida diet, sugar-free, wheat-free, mold-free, and we put her on supplements, replete her antioxidants, and probiotics, of course, which is important for promoting proper inhibiting the overgrowth of the candida. We did try her on a nice statins after a while, and this did produce problems with her. We had to pull her off. You know, sometimes we take a step forward and we take a step backwards. And she got Vega testing and was found to be quite intolerant to nystatin. And she's now on the Ordaco as an antifungal. We did intravenous therapy with vitamins and minerals. We gave her intravenous Maya shots. These are very good for improving intracellular health. And then we also introduced pulsed electromagnetic fields to improve the cellular membrane integrity. We moved her away from, she wasn't taking fish oils, but she could tolerate essential fatty acids in the form of parent oils, in the form of omega-6 and omega-3 oils in balance. And as a result of, and we sent her to conditioning. She went to conditioning exercises at vital steps to improve balance and muscle tone. so we did that as well. And she came initially in the summer in June, and now she's doing much better. Her energy is back, her digestion is improved, and she's generally, and her strength, she's stronger, her muscle strength is more. So that's one application of integrative medicine, where you employ various nutrient techniques. The one thing we didn't do, we could have put on stand drugs for high cholesterol, right? We could have stand drugs, but in view of a history of severe muscle weakness, we decided maybe that wasn't the wisest thing to do. And she's presently taking plant sterols and pantofene to help lower cholesterol. Okay?
So I'm going to talk about another case. This is a 31-year-old female who came in with, a lot of our patients come in with the complaint of fatigue or restlessness or irritability as a sort of an opening symptom, and then when we do some investigations we find other things that are going on. She'd been feeling this way for about a year, and it sort of started with the recent death of her father and the birth of her first child. She also had some other sort of odd signs and symptoms. So she had an abnormal taste perception. And then she had great thirst and frequent urination. She had dry throat, dry hair. She had very light menses, and she had dream-disturbed sleep. So from a conventional perspective, a lot of these signs and symptoms could be considered, hypothyroid symptoms. They could be considered diabetes symptoms. And so we have to look at ruling those things out. Objectively, she seemed very healthy and vital. She seemed very young for her age. We do a lot of conventional blood tests to rule out things like diabetes and thyroid. So we did a complete blood cell count, a CRP, which is a marker of inflammation. We did ANAs, which are a marker for lupus. TPOs are a marker for autoimmune thyroid disease. And we looked at her blood sugar, fasting blood glucose, and hemoglobin A1C. We looked at her kidney functions, obviously, because she's urinating a lot, she has a lot of thirst, so anytime you have fluid issues, you need to look at kidneys. We looked at her electrolytes. We also looked at the enzymes in the different cells of her body. So we looked at liver enzymes and pancreas enzymes, and muscle cell enzymes. We looked at her cholesterol panel and her thyroid panel. And we also assessed her B12 and her reproductive hormones. And all of those were completely within normal limits. The only thing that came up on conventional blood tests was a low serum zinc. It was quite low. We see this a lot. A lot of times people's serum zincs are moderately low, but hers was, I think, quite low. I think it was like 7 or 8. It was quite low. And then on urinalysis, everything was clean as far as infections and blood and glucose, but her specific gravity was very low. So specific gravity essentially measures the concentration of urine. And so the closer the number is to 1, the more like water it is. So typically it should be sort of 1.010 to 1.030. So hers was quite low on her first morning urine, suggesting she has quite dilute urine. We also did a stool test, and we found blastocystis hominis, which is a parasite, an intestinal parasite, and no yeast growth. So that was something that she didn't come in complaining of digestive complaints or weight loss or any of those sort of classic parasite issues, but here we found quite clear evidence of blastocystis hominis. And also we did a blood test which screens for H. pylori, which is a bacteria, stomach bacteria that can cause ulcers and can cause heartburn. And so she had a very high level of that. That test isn't conclusive, but because of the high level and she's never been treated for it, it's pretty suggestive. We also did the bioimpedance analysis that Dr. Jaconello talked about, and her phase angle was a little low, again suggesting poor cellular health. And the same with her intracellular water, which isn't too surprising. If she's losing a lot of water through her urine and she's feeling dry and thirsty, it's not surprising that her intracellular water was low. We also did a hair mineral analysis test on her, and that was relatively normal. There were some mild elevations of mercury, calcium, silver, and some low sodium, which again is not surprising considering she's losing a lot of water. Interestingly, her hair analysis for zinc was normal. So this is something that we see sometimes that we need to, especially with the zinc, we need to have different measures, right? So the serum was low, the hair was normal. We need to look at different compartments to understand what's going on with these. And her antioxidants and oxidative stress were relatively normal. So there wasn't a lot of diagnostic. I mean, there were some things we found, but they didn't seem to have a lot to do with her symptoms. So we assessed there's no diabetes. We did find B. hominis, probable H. pylori, a zinc deficiency. And then, so part of the naturopathic training includes traditional Chinese medicine and other Eastern modalities. And so from my experience in that, the symptoms of thirst, frequent urination, dry throat, dry hair, light menses, and dream disturbed sleep are all signs of blood deficiency. So again, that's an Eastern diagnosis that doesn't corroborate with her blood test because her CBC was completely normal. So she didn't have a Western blood deficiency, but she had all the signs and symptoms of a TCM blood deficiency. And so I referred her to Dr. Helen, who is our traditional Chinese doctor, for treatment with acupuncture and Chinese herbs and Jaconello, which is a form of massage. We treated her for H. pylori, so that's usually one of the first things we do. So H. pylori is an interesting thing to treat because of the conventional medical approaches called triple therapy or sequential therapy, which is a proton pump inhibitor and 2 antibiotics, which is for 10 days, which is a sizable assault on your digestive tract. And even then, it's still only effective in 78 to 90% of cases for eradication. And so there are lots of natural agents that help to deplete the amounts of H. pylori, but none of them eradicate it. So this is a case where we combined therapies. We used triple therapy, which you get as 3 drugs, but we also used broccoli sprouts, garlic, and mastic gum, which helped to decrease the amount of H. pylori before beginning triple therapy, and that increases the efficacy. And we also use probiotics to help decrease the side effects. So that's a perfect example of how the two worlds meet. We treated her for B. hominis with something called ADP, which is a emulsified oregano oil. So again, we could have used antiparasitic drugs, but in this case we chose to use ADP because there's really good research for that specific organism. We replaced her zinc with zinc carnosine, which is a particular type of zinc which is easy on the digestive tract and can actually help with H. pylori infections. And then, like I said, we referred her to the TCM doctor for Chinese herbs and treated her HPA overactivation or stress anxiety with an adaptogen formula. And then the other things are sort of the standard trace minerals and multivitamins to replace the nutrients that were low. And of course, essential fatty acids are often indicated in conditions where people have dryness. So that's another example of how we sort of combine these two fields, both conventional, naturopathic, and traditional Chinese medicine. We used conventional medicines, natural medicines, and energetic medicines like acupuncture.
The triple therapy, is that the conventional antibiotic and PPI?
Yes.
Okay.
So we use sequential therapy with 3 antibiotics, amoxicillin, then followed by clarithromycin, and tinidazole, which is an antibiotic used in Europe. So we do it sequentially, and the PPI for 10 days. 5 days of amoxicillin, 5 days clarithromycin, and tinidazole.
So it is intense, but so if you look, there's a lot of great natural therapies that help to reduce the amount of H. pylori, and as long as you continue on those, you'll have lower amounts, but the minute you stop taking them, it comes back. So there's no eradication is not effective. But even with triple therapy, eradication is only found in 78 to 90%, so it's not completely effective either. So that's why combining the two can help to get eradication.
The sequential therapy eradications can be up to 96%. For research in Rome, they did that research. So, yes?
Sorry, is this the woman that had the vivid dreams?
Yes.
Okay, and that's why she was treated with HPA overactivation with the adaptogen formula?
That's part of it, and also blood.
She was overactive.
Yeah, so that's a common sign. A lot of people come in and just keyed up. Their stress response is keyed up. But specifically, overactive dreams during sleep is a sign of blood deficiency in Chinese medicine. So which again has the same similar results of feeling of palpitations, feeling of anxiety, not being able to sleep. Those are signs and symptoms of that.
Can't hear you. Can't hear you back.
Oh, sorry. She's really great. She got an excellent response from the TCM doc. She took wheat piton, which is a blood-building formula, and after I think 2 or 3 sessions, she's feeling much better. And she's pregnant again with her second child. That's pretty cool.
Wheat piton, is that Chinese medicine?
Yeah, it's a Chinese formula.
Is there any other questions? Yes.
So mastic gum is okay with antibiotics? Mastic gum and antibiotics?
Yes, as far as I know, yes, it's pretty safe.
The question was, is mastic gum safe with antibiotics?
And yes, it is.
Back?
Hi there. What about instances where people are allergic to the antibiotic? How would you treat H. pylori?
Okay, so how do you treat H. pylori if they're allergic to the antibiotics? Well, then you have to change your antibiotic procedure. So if they're allergic to amoxicillin, you've got to figure out another antibiotic to use.
I also have some patients that are really just opposed to antibiotics, and in those cases I recommend they stay on the suppressive therapy. So they stay on, for example, broccoli sprouts is one really great method that suppresses H. pylori. So while it's not going to eradicate it, if they stay on it continuously, they won't have the negative effects. They're really that opposed to it.
Did that answer your question?
Yeah. Well, I think if you're allergic to a lot of the antibiotics and everything, you have to go natural.
Yeah, that's right. You have to use natural remedies. Sorry, your question?
Sorry, I'm on early. Would you be able to state the reason why they're allergic to the antibiotics and then proceed to...
If they're allergic to amoxicillin and have an anaphylaxis or breakout, I wouldn't even go there. I wouldn't. You could potentially, but I know we wouldn't take the risk for that.
I got in high school. I got 2 of the 3 vaccinations for hepatitis. I think it was B or C, but I missed the last vaccination. And when I took a blood test, one clinic they told me that I'm susceptible to getting a disease via saliva, like kissing or sexual intercourse. What is your view on vaccinations?
Don't want to go there.
What do I do if I don't go there and I don't want to end up like Pamela Anderson with hepatitis A, B, or C? What do? I don't want to die kissing somebody or...
Well, you can't live your life in fear. I would suggest, that's something we could take up separately out of the meeting.
If I may. If I may add to that, if your immune system is high enough, you won't get Hep B.
Yes. Yes.
I don't quite understand what you said about those receiving case. Did you say that statin drugs weaken muscles?
Can you repeat the question?
Do statin drugs weaken muscles? One of the major side effects of statin is muscular pain. A statin drug is like Lipitor.
Oh, yes, okay. It weakens muscles, right?
Yeah, statin drugs can weaken muscles and lose a lot of muscle mass taking those drugs.
Oh.
Yeah. Any other questions? Yes.
So how do you mitigate the muscle loss and then graft?
Sorry, can you repeat the question?
How do you mitigate the muscle loss of patients that need stent graft?
How do you get it back?
How do you mitigate the muscle
So
loss?
how do you help with that?
The question is how do you mitigate the muscle loss? Well, I would say you take something else other than statin drugs. There's lots of other things that can help lower cholesterol, if lowering your cholesterol is even a useful therapeutic target for you. So you avoid the cost.
What was the ANA test again?
Anti-nuclear antibodies is a test for, it's basically looking for antibodies against the nucleus of your cells. It's a screening test for lupus.
Okay, thank you.
Any other questions? Yes.
I'm not sure I heard well, but I think the doctor said there are ways to maintain teeth without root canal. Is that what I heard?
The question is, there are ways of maintaining teeth without root canals. If a tooth hurts but is not dead, it does not need a root canal. If the nerve inside is dead, then either root canal or extraction is a necessity because you're going to get an infection. Many root canals are done, unfortunately, unnecessarily because the person has pain and the dentist can't find why. So the way to get rid of the pain is doing a root canal. It is one of the worst reasons to do a root canal. If your tooth is still sensitive to cold, you don't need a root canal. If it's sensitive to hot, you have a dead infected tooth. If it's sensitive to bite only, You may have a crack in the tooth, and there are other ways of dealing with it. However, if you have a root canal that has been done properly, and one of the things I mentioned is it depends on how, when, etc. If a young person falls, breaks a front tooth, the root canal is done immediately. It has not been infected. It is done aseptically, well sterilized, and filled with an expanding material like endocal. The possibility of that tooth being okay for the body is very high. However, if that tooth was infected for a while, and especially if you didn't realize that the infection was there, you really don't have good chance of that being healthy for your body. If you have, let's say, a bridge on a tooth that has a root canal or needs a root canal, and that is the only way you're going to be able to chew, then there are root canals that are safer than the average gutta percha filled root canal that is out there. You would need to go to a holistic dentist and have it done, and the adjunctive therapy to that is medical grade ozone. Because ozone sterilizes on contact, you can sterilize the inside of the tooth and then maintain that tooth in some semblance of health by regular ozone injection. Thank you, that was a good question.
Thank you.
Yes.
Since we're on oral health, do you have any suggestions as to the healthiest way to approach denture? Secondly, are there any medical schools yet that offer an option in integrative medicine? And sort of related to that, what about the college of physicians and surgeons? How are they currently reacting to integrative medicine?
As far as dentistry is concerned, there is no school that offers biological dentistry, but there are societies. The International Academy of Oral Medicine and Toxicology is one that I belong to, and it is a membership of 700 worldwide that has a motto, show us the science. And they are the ones that are lobbying the FDA to get rid of mercury out of dentistry. I am on the Committee of Environment Canada to try and get mercury out of dentistry in Canada. I'm not sure what it is, New York University or Columbia, I believe it's Columbia, has now officially stopped using mercury fillings. And as far as learning integrative or holistic dentistry, it's beyond the universities.
As far as the College of Physicians and Surgeons, I don't wish to comment too much on that subject at this moment. But I don't want to comment.
There are starting to be some programs that involve integrative medicine in conventional medical colleges. In the States, yeah. But I would suggest that they are highly evidence-based, which makes them necessarily highly restrictive. So I think it's a good step in that direction, but I think there's more to be gained by taking experts in all these fields and combining them than trying to teach one person everything.
I came in late, okay? So I came in at 1, so I'm capping the last half hour or whatever. So you may have already talked about this, but my question is, and one of the reasons why I came to this place is I wanted to look for anything for EMF protection, especially for my cell phone. And we're being bathed in EMF. And I actually have a problem with this side of my head because I've used my cell phone for 15, 20 years now. And is there anything out there that really does work? I have found fabrics and sheer meshes on the internet, but I don't know if they're really going to do anything.
They really work.
Yeah.
Those really, I have a patient highly sensitive to EMF, and it's the only thing that helps them.
There are also little buttons and various shields that you can have. One of my favorite is the shungite stone, because it's a natural stone that attracts the EMF and changes the wavelength to something that is more compatible with the body. This is something I have on my cell phone and on every cordless phone and on every computer in the house. I do not use a microwave.
You know, some people say that your body should resonate at a certain hertz. Some people say live food and a good body should resonate here at 75. But everyone else is talking about resonating at 8 and 9 hertz when they use these buttons and shear mesh and all that. Scientifically, how does that work?
I don't really know. We find that the use of pulsed electromagnetic fields is proven useful to improving cellular health, the integrity of the cell membrane, and the plus and minus in and outside the cell. Because that you need that gradient across the cell membrane, because it's the cell membrane that defines how we function. If the cell membrane gets dysfunctional, no amount of vitamins and minerals is going to help until you repair that membrane, which requires pulse electromagnetic fields. Essential fatty acids are really important for cell membrane, and phospholipids to repair the cell membrane.
I don't think we didn't mention this, but we also have an environmental counselor that sees all our patients and goes through exposure to EMF.
She's really good.
She's really good.
Have we finished? Okay. So I think we finished.